Honorable Dr. Letlape.
Thank you, Chair. To start by saying, I guess the person that can't be recognized is Honorable Mutubate. He's just sent a message. He's having problems identifying himself on the gadget. My questions go back to just some basic understanding. When we talk about the Department of Health being able to set out the responsibilities of the three levels of government in terms of the provisions of health services, what do we mean? Aren't there certain responsibilities that are conferred on provinces by the Constitution? Because one of the problems that is coming up is the fact that you can't have a national anything, national health insurance, national this, if health is not a national competence. And what is the Commission's view on that? Because part of the problem is that when it comes to certain things, the Department of Health can't get people to account because they say it's their own responsibility. If I give you an example, with this money that has been made available to employ 1,200 doctors and 200 nurses, the proportions of which are an enigma for me because we need more nurses than doctors. But be that as it may, at the National Health Council, the minister is pleading with the provinces and the MECs to use the money for the purpose that it is intended for. But he's aware that they can use it for anything they want to, and there's nothing that he can do. How do we change that? I hear a lot about most of the budget being a conditional grant, but when it gets to provinces, it can be used in any way the provinces deem fit. If it is a conditional grant, are the different amounts attached to different line items? For example, so much for laboratory services, so much for human resources. And if it's money for human resources, is it broken down according to money for frontline, money for managers? I hear a lot about preparatory work for NHI, a commission recommendation from 2021 to 2022. And concerned about the fact that the budget seems to have gone down. And even with the 1.7% increase in this period, it seems not to take us back to the levels of the budget of 3 years ago. Just a comment on that. And we talk about an NHI underspend of minus 7.6. But we have no money to employ healthcare professionals. One of the issues that comes up out of your presentation is the fact that it looks like the emphasis of the NHI is to bring in the private sector. We talk a lot about outsourcing of services like oncology, mental health, GP services. You go to Charlotte Makake, it's an absolute disaster. Money has been taken back to Treasury for oncology services. We are destroying the capability inside the public sector. And I'm just concerned about the fact that we don't seem to use this as an ability to rebuild the public healthcare system. Any system that wants to offer what we want to offer, universal quality healthcare, has to be largely dependent on employed healthcare professionals, not contracted outside providers. I'm not saying the contracted outside providers don't have a role to play, but that can't be the key focus of how you want to build a national health system. And I'm concerned about ignoring the public healthcare system. Instead of rebuilding the public healthcare system, making it the place of choice for healthcare professionals for employment, we don't seem to be going that way. We seem to improve our capability for contracting with private providers. Now, on what Dr. Leroux has raised about the integrated national information system, it is key. And contrary to what he says, it's a key factor to an efficient system. And it can be done. Many people have done it. We've done it in the banking sector. All of us carry multiple banking cards. But anywhere you go, people are able to know what your balance is. And when you want to withdraw money and you don't have money, you are told that, hey, Baba, there's no money. Contact your branch. So that thing can be done. But it can't be done in isolation. It has to be part of the security system in the country. You go to other countries, every citizen is issued with a card from birth to grave, cradle to grave. You're given a card and it picks up all your information system. And anywhere you interact with the healthcare system, people have your healthcare information on tap. It is not impossible, but it requires to be done as a national competence. And just for information, if you did an assessment of how much we've spent in national and in the 9 provinces in the last 30 years on information systems, you will be horrified. Now, I wonder, and maybe you could explain to me, because when I hear about NHI, it's about a term where we're trying to fix the public healthcare system. But the emphasis on what divides us is that it seems to concentrate on funding, instead of just being truthful about, can we fix the public healthcare system? Lastly, Chair, I want to go back to the beginning to hear from the Fiscal Commission. When Section 27 talks about available resources, is Section 27 open to separateness, where you have a private system and a public system? Or does it talking about one nation, one health system? And the promises of Section 27 of the Constitution, are they to any human being that breathes on our soil? Or are those promises to citizens? Because if the promises are open-ended, like the Freedom Charter, then this is not doable. Nothing is doable in this country unless we talk about citizenry and services to citizens, and all citizens being in one pot. So that when you build a public healthcare system, all of us as citizens, irrespective of our levels of poverty or abundance of resources, we need to be able to depend on what the state can provide. So the state can't be providing to the poor, and the state officials for their own healthcare go elsewhere. So I just want a view from the Fiscal Commission on those issues about within available resources and the 2-tier system, and how that is going to work. Because if it becomes the undertone, it means even your NHI will be undermined by the 2-tier system. As you've heard, a lot of people are saying, leave what we have alone, go fix it for the poor. So I need to hear from the Fiscal Commission around that issue that poses a problem for us as South Africans. Thank you, Chair.
Totally.